Welcome back to another episode of Forces Infertility. I am so excited that you're here with us this week. We are joined by Dr. Karenne Fru, MD, PhD, double board certified OBGYN and reproductive endocrinologist, fashionable with the best shoe game in town. And you hanging with me this afternoon.
Of course. Where else would I be?
Oh my gosh. I am so excited. I can't wait. Our team had the pleasure and honor of getting to have you speak with us just a few months ago. And honestly, they won't stop talking about it because of your hilarious analogies. And a little birdie also told me that you might be dabbling with a career in stand-up comedy too. Are we adding this?
I might have to. I have toddlers. Comedy gold.
And mom
Absolutely.
of two, by the way, as if you didn't have enough on your plate.
Oh, but that's the fun part.
Oh, I love hearing that. And that's honestly why we're all here and doing what we're doing. Well, I'd love to have you introduce yourself a little bit and kind of give a little bit of backstory.
Okay. So right now I am the founder, yes, and CEO, medical director for Muna Fertility.
Amazing.
So Muna Fertility is the culmination of my 10 years of clinical practice as an REI. And I've been in different practices, and this is my attempt to create like a welcoming environment that it has a lot of compassion and affordability built in so that patients who look like me and other marginalized groups can have access to care in an environment that's warm and fun and, enjoyable. A lot of my job, especially at the very first visit, is to contextualize what is actually real versus what is imagined.
Got it.
And then we kind of do a reset and some grief counseling.
I know.
Because nobody wants to be sitting in my office.
No.
Let's be honest.
Except for our donors and surrogates. They don't mind hanging out with you.
They don't. But I tell people that if you wind up in my office, that's a good place to be if you have a problem that I can solve. And that's really it. Physicians are problem solvers.
Yeah.
And reproductive endocrinologists solve the problem of infertility one way or the other. And so if you go through with fertility care, right? And you go through a couple of cycles and it's not successful with your own gametes, either eggs or sperm, and you have to turn to using somebody else's eggs, sperm, or uterus, that's third party, that's not a terrible place to be because you've made the decision that in spite of everything, you wish to become a parent. And that is the question that needs to be answered. Do you wish to be a parent or do you wish to have your genetics passed on? And once you figure that out, if you only want your genetics passed on, then everything stops after all treatments using your own eggs, sperm, or uterus end.
And that's huge. It's a huge decision. And I think that's really important for the donors to really understand also, and the surrogates, because you think about this, the person that you are donating to, still in this day and age, there's not a ton of communication with the donors and the parents, especially if you're donating to a bank. That's even less of communication there. Surrogates, you're able to kind of connect with the family a bit more, but even that, it's sort of guided through the agency's, protocol. But with the donors, it's nice to see that, despite the grief and despite the cycles of IVF, and not the case for all intended parents that take on this path. Some know when they're coming into it that this is the route that they're going to have to take. But for others that didn't, they're really actively making a choice and a decision to have and bring this child into the world. And it's so beautiful. And they have so much love and compassion that goes into it. And it's so incredible to see. I mean, I'm working on the intended parent side at the clinic. I got to see the families also, not just the donors.
Yes.
And you get to work with so many families that care so much. And it is so important to them to have have this child entered into their family, and it becomes everything for them.
Well, yeah. Becoming a parent is a life sentence.
It is.
And I tell them that.
Yeah, it is.
When I discharge patients from my
discharge, that sounds
discharge. Yes. Bye, I'm done with you. I sentence you to a life of
with
parenthood. No
Good
take
luck.
backsies. No take backsies.
Oh, I know.
Even when they're extra sassy.
Yep, you can't.
And that's really what it is. I really try and remind people that going through this process, you have to be a little zen.
Yeah.
You have to be present in the moment and understand that if you cause this unique genetic event to happen, right? You choose this particular donor who would never otherwise have come into contact with this particular sperm source. You create a completely unique, you intervened to make happen a unique genetic event that then will become a person.
Amazing. I
know.
Walk us through that genetic event a little bit, because that's another part that I like to talk about. And our donors, now that we have Dr. Fru here with us, I'd like to, pick your brain a bit and tell us a little bit, because, maybe you can tell us a little bit about the donor experience and the surrogate journey.
Okay. Let's start with the donors.
Let's start there.
It starts with the egg.
It starts with the
and
egg.
ends with the egg. Everything is egg dependent. Cue egg puns. Very bad ones.
Exactly.
Anyway.
Keep them coming.
She'll be here till Friday, everybody. Try to fish.
I'm going to go do stand-up with you.
We should do a duo.
I'll be your opener.
Oh, wonderful.
I'd rather not be the main show. But
yes, it's going to be mostly about kids, egg puns, and whatever else. Maybe sperm are funny too. I don't know.
Sperm can be hilarious.
It's funny looking. All right. In all seriousness, the egg donor, meaning the person from whom we are going to get the eggs that are going to go into somebody else that they're not related to, or that person is essentially going through the front half of IVF in lieu of the intended parent.
Right.
Okay. So they are going to undergo, typically the protocol is about a couple weeks, 10 to 14 days, although egg donors are nice, young, healthy people. It's usually 9 to 10 days of injections and a couple ultrasound and blood draw visits. And then we track how big the follicles are getting. And when they are the right size, somewhere between 18 and 22 millimeters, then they get something called a trigger shot. I know, I really don't like that name because it reminds me of guns, and there are no guns involved.
None.
It's an injection.
No guns were
no guns
used in making these children.
No one was harmed. And then 2 days after the trigger, we do an IV sedated procedure. The donor goes to sleep, and we remove the eggs.
How long is that procedure?
15 minutes.
Yes. So 15 minutes. But that's good to know, though. I mean, that part of the process, I think, can be very intimidating because you're going under anesthesia and, it's...
And so the thing that I tell most individuals, because it's not just the donors, patients hoping to use their own eggs tend to worry about, they hear anesthesia and surgery. And these are just words. So let me give them some context. The anesthesia is IV only. There's no tube going down your throat. There are no paralytics.
Yep.
In fact, you're breathing for yourself. There's a reason why we have a BMI requirement. Because otherwise, if you're too heavy or you have a compromised airway, I can put your life in danger by getting you to fall asleep.
So you touch actually on a really important point too, BMI.
Mm-hmm.
This is something that a lot of the community at large talks about, and it's on TikTok. There's a lot of buzz about it. And while I do agree with a lot of the reasoning behind it, while, BMI, it's tough to really base everything off of BMI because you have people at different heights. And
That
tell
is
us
true.
a little bit about why BMI is so important for
In IVF.
Yeah.
Okay. So not all BMI is created equal.
Exactly. Yes.
If you are a power lifter, then your BMI might be excessive, but it is because of all the muscle mass that you have. But that will typically be restricted to the lower end of the spectrum. So you might be a BMI over 30, which technically is obese, but
can you believe that?
But looking at the person, we wouldn't have that be a limiting factor.
Right.
And in fact, for most cases of IVF, we are able to go up to a BMI of 40. Now, I have not seen a power lifter with a BMI of 40.
Okay. Good to know.
At a certain point, we all have to admit that the BMI actually gives us useful data.
Yeah.
As in, this person has excessive weight. And that may not affect a lot of things, but it does affect egg quality for starters. And why would you want to put somebody through a process if the egg quality is going to be compromised?
Right.
Eggs that have been exposed to excessive weight for a period of time function like older eggs. The older a person gets, the older the egg gets, the less efficient it is in converting from egg to embryo to baby, which is the whole point of using donor eggs.
Right. You want the best chances.
Correct. Because most of the people who are now relying on donor eggs have failed that test. Their own eggs have not converted from egg to embryo to baby.
Right.
And so they're looking for an improved chance of this happening, hence the discrimination.
Yeah.
And the second part, so that's the egg quality. The second part is the technical aspect of doing a retrieval. So for a retrieval, the stimulated ovaries typically lie just adjacent to the vaginal wall. So we do ultrasound and the needle goes through the vaginal wall into the ovary. When you have excess weight, that whole space thickens. Your visualization of the ovary is compromised. It's just hazy. You can't see as well which follicles you're emptying.
Got it.
You can't see as well which follicles are growing. So your decision-making is compromised, and technically your retrieval is compromised.
Got it.
Not to mention what I was talking about earlier with the fact that we rely on you to protect your own airway. If you've got excessive weight here and it presses down, your oxygenation might not be as good during the procedure. I will stop a procedure if it puts your life in danger.
Of course.
And I will not do a procedure if I can see from the outset that I will endanger you.
Right. And it's tough because, you don't want to put someone through the, 2 weeks, however many days of injections and everything just to lead to a retrieval that might have to be stopped.
Yeah, no, that person would not make it that far.
Yeah. Yeah.
It is absolutely my job to care for the person donating eggs.
Absolutely.
Because they are my patient.
Yep.
And so if I'm going to do something that will inadvertently hurt them, I will not do it. And I will explain why.
Yeah. And that's something, just when we started All Kind, it was really important to us to work with the right physicians and the right teams that are going to prioritize the donors and surrogates as patients, because they are in this
They
process.
absolutely are.
They are. And, they're just as nervous as the
As
IVF
anybody.
patients or the parents that are going through it.
They're going through the exact same thing.
Yeah.
You're having to, I want everybody to be empowered in this process.
Absolutely.
I want everybody to understand why I'm telling you to take this med at this time. And that way, if you don't, maybe it's an accident,
right?
Then you can let me know.
Yeah.
So that I can adjust.
Fix it. Yeah.
I can't fix what I don't know is broken. So
a lot of communication is so important
so
through their
much
process.
Communication.
Yes.
It's a relationship.
They're going to be talking to you a lot.
It's a relationship. We're constantly communicating.
Oh my gosh. Who wouldn't want Dr. Fru to be their doctor through this whole thing?
Well, I'm not everybody's cup of tea.
I don't believe that.
I'm blunt. I crack inappropriate jokes. And I'm just I'm just a happy nerd.
Yeah.
So if that's not what you want, because you want a more serious doctor, then you are invited to go elsewhere.
Right. Absolutely.
And that works for me too.
That's the power of today and access to social media and access to the internet and being able to really be a lot more in charge of your journey too. And we like to tell our donors and surrogates do your research, make sure that you feel very comfortable in the not just with the agency, but the clinic that you're working with as well. Correct. It's huge.
It is your life.
Yeah.
It is your health. And everybody should feel like their doctor, their clinic is in their corner. And if you don't get that feeling, you need to say, hey, I know you guys are nice. You're trying your best. I don't feel comfortable here for these reasons. And I'm leaving.
Yeah. And a lot of also what we really like to talk about at All Kind is not just the donor and surrogate journey, because that's, of course, why you would go through this.
Oh, of course.
But it's also about just empowering your life in a lot of different ways, too, and empowering yourself in the journey that you're taking, whether it's you want to buy a house, you want to, advance your career, go back to school, do the things that make you happy and fulfilled in this lifetime.
Correct.
Do you have any piece of advice for a young person that's going through life right now and trying to figure it out and kind of having all this noise and pressure from the outside world and just saying, you know what, I'm going to take control over my life and I'm going to do something like this to not only help someone else, but help myself? What piece of advice would you have for them?
Run your own race.
Interesting.
It's something I tell my kids.
Okay.
So I grew up in Cameroon, West Africa. And there, I didn't realize that my vision was compromised. I sat at the front of the class and I got hit by many volleyballs. I couldn't see they were coming. My depth perception was off because my vision was off.
Got it.
Okay. And I realized that the only thing I could do really, really well was run. I could do track because I wasn't interacting with anybody else. I just ran my own race. And that is true now. When my 6-year-old says, "Oh, mommy, I'm not as good as so-and-so at this thing," I go, "But you're doing it. Just run your own race. Life is not a competition. You owe nobody anything. Nothing but put out the kind of emotion that you wish to receive. And if you don't receive it, that is not really your problem, right? That's somebody else's problem."
That's huge that you touched on that. As a young professional going into any space in any career, or even at whatever age you are, you feel like you're always in your head thinking, do I belong here? I think a lot of young people, or just people in general, are facing, maybe imposter syndrome, or maybe feeling like pushback, or they don't belong in a certain area, or some goal is too big, or it's too far out of reach. And I love that you say run your own race, because you're doing this on your time, your own terms, and you're doing it. You're going out there and you're doing it.
There you go.
When we started All Kind, I I was so shocked because I just thought the world would be kinder and more welcoming to two young girls that are going out there and trying to start a company. And it wasn't necessarily the welcome that we had thought. And that surprised me.
So as someone who's not quite as young as you, but who also gets maybe put in categories.
Mm-hmm.
Women struggle with this thing because we get raised with the urge to please.
Yes.
Right? The urge to conform and the urge to be what other people see us as.
Yes.
Right? And I only started being truly happy when I realized in my old age that I only found that I was happy when I decided to choose joy. So that's the second thing I would say.
How do you choose joy in moments that feel dark and overwhelming?
You make a list.
Oh, okay.
Like any good organized woman, you make a list and you run that list through your head.
Yeah.
And then you shake your head, square your shoulders, and put on a smile. Nothing is more intimidating to people who do not wish to see you succeed and who wish to put you in a category as a woman who is standing tall and smiling.
Oh, I love that.
That says, yes, I understand the challenges and I am choosing to be happy in spite of it.
So powerful.
Because for me and for everybody I interact with, I go, life is terminal by design. Our bodies will eventually fail. And what I do for a living is I function in this reproductive window. And that is all it is. There's a period, it starts and it stops and it's finite. Right? Because it's just when we choose to have kids. It's a finite window. Like for me, I am done with reproducing and my God, I am relieved. Because I struggled with infertility. We went through hell and back. And I thankfully have 2 daughters, but I would have stopped after the last pregnancy if it didn't work out. Everybody has their limit. So
absolutely.
I just keep telling people, don't think that this is your life forever. This is your life for right now. You've got one life to live.
Yeah, one life to live.
Live it.
Do the thing. Do the thing that scares you.
Do the thing.
Go do stand up. And
this is not really happening, guys.
We're going to make it happen. Do the thing. I would, I hope that outside of just speaking about the donor and surrogate journey and getting more informed about, your power in the situations that you're in and this journey that you're in. But beyond that, to know that you are in control of your life. You have this one life to live. And so live it. If you want to be a donor, if you want to be a surrogate, if you want to help a family, do it. If you want to then use the compensation that you receive to go on that trip that you've been dying to go and do the things that make you happy and fulfilled in this life, because you only get this one life.
You only, as someone who's almost died, you get it precisely.
Yeah.
One time.
Yeah.
And my goal is to die happy.
Yeah.
I want to
choose joy.
Choose joy until the end.
Until the end.
Until the end.
Well, it has been so joyful to have you on here. I have loved every second of this. With our podcasts, we never know which direction it will go. That's the beauty of it. And I really truly feel so touched by this. I hope that anyone that's listening feels that way too. And if you all have questions, if you'd like to hear more from Dr. Fru, DM us, send us a message. We'd love to have you back.
Oh, yeah, absolutely. We could talk for hours.
Clearly,
we are comedy gold.
Gold. You don't get this kind of stuff everywhere. So but we're going to wrap it up because you're going to have to come see us live at a
Absolutely. We're gonna
at a comedy show near you.
There we go.
All right. Well, thank you so much. It has been quite eventful, and I can't wait for next time. Thanks again.
Until next time.
See you next week.